In Wednesday's Senate Health Committee hearing, Louisiana Senator Bill Cassidy questioned Dr. Anthony Fauci, Dr. Rochelle Walensky, and other top health officials about the monkeypox outbreak. The leaders of the nation's top health agencies are testifying on the spread and prevention of the viral disease that has become a global emergency. Cassidy, a medical doctor and sometime critic of Fauci and Walensky, cited his constant demand to know the percentage of CDC employees who are working remotely. He claimed Walensky has refused to answer him in the past and confronted her with new numbers.
To Senator Baldwin, and our next senator is Senator Cassidy.
Thank you, Mr. Chair. So I was a medical resident in 1983 to 1986 during the HIV epidemic, when HIV just exploded. So I'm very aware of the need to have a robust research and public health response to infectious diseases. Now, Dr. Walensky, part of this has got to be predicated upon trust between the American people and the agencies, that the agencies are functioning as best as they can. And I feel like that trust has frankly been dissipated. And I'm sorry to say that because I respect you as a clinician, as a person. But I've asked you on multiple occasions as to what percent of the CDC workforce is actually showing up. Frankly, you've always blocked that. You've never given a straight answer. So I'd like to enter for the record an article from the Epoch Times in which they did a FOIA request to find out how many folks at CDC were actually working, showing up, so to speak. And roughly 2,772 out of roughly 13,000 employees are showing up every day. But 78% are working completely remotely or come in maybe only twice every 2 months. Now, why is that important? First, that was a knowable fact, but it was not shared with Congress, we, the representatives of the American people. And I think the American people would like to know that if CDC is not functioning well, how many of the people are actually showing up? Now, I mentioned CDC is not functioning well because I now reference an article, which I'll enter for the record, from New York Times on August 17th, in which you, frankly, to your credit, point out CDC has not been working well, and that there is need for wholesale change. And at the end of the article, they quote an acting director under President Obama, Dr. Besser, who says that it's hard, first pointing out that you're still working remotely, you yourself are working remotely, at least of August 17th. And then he says, but it's hard to see how Dr. Walensky could execute wholesale changes when she only sees most of her staff at a distance. Quote, I don't know how you motivate and inspire culture change when people aren't together. Now, CDC is requesting billions of dollars for public health initiatives in an agency which, by your assessment, is not functioning well, in which only about 22% of the people are showing up every day, and in which previous Obama officials are doubtful that you can affect change because you don't show up every day. And I say that kind of painfully because I want the CDC to work. And yet, and one example, and I'm sure there's a reason for it, but there's been a lot of talk about the need for local agencies to have to modernize. But CDC was given $200 million under the CARES Act for data modernization to be awarded to 64 different state, territorial, local jurisdictions. And maybe this is HHS, maybe it's not CDC, but most of it has not yet been spent or allocated. This is according to CRS. So it's incredibly frustrating that a deliberate decision was made to not be transparent with the American people as regards the amount of people actually showing up for work. It takes a FOIA request from a newspaper, and now you're asking for billions more. Why should we trust?
Thank you, Senator, for that comment. I will say that we are an agency of 13,000 people. The people who need to be at CDC are at CDC, of course, our laboratory workers. We have many people in the field. We have people in 60 different countries.
Yes, but the article points out that there are many, that it's just wide open, that there's nobody showing up, that the offices are empty. So to suggest that all these people are field workers, I think, again, is another example of being opaque.
I don't imply that they're all field workers. I'm saying that many of them are field workers. Many of them are working at CDC and then deployed in responses, and many of them are on the road. I myself was in Atlanta last week for a day, but I was in New Mexico with tribal visits and doing a secretary's tribal advisory committee meeting. So many of us are on the road. I am here today, and I am working.
I'm sorry, what percent of CDC employees before the pandemic actually showed up for work every day as opposed to the only 22% now?
I don't have those numbers for you.
Yeah, I just feel like, and let me go back to, why should we trust CDC with billions when it's very difficult to get, I would say, a straight answer on what is the workforce in-person effort, and particularly when, by your own assessment, the agency is working so poorly?
The review that we did on August 17th was to demonstrate the lessons learned from the COVID-19 response. The people of the CDC are working well, they're working hard, and they don't necessarily need to be on-site in Atlanta. In fact, oftentimes they're more productive off-site in the field doing the work of public health.
So we're out of time, but let me just say that the former acting director of CDC from President Obama, when he said in the last paragraph of the New York Times article, he did not see how you were going to be able to, speaking of you in particular, affect change when you only see people every now and then. He was both suggesting that it was not a work completed, but it was something that had to happen now, and that when people not working together made that more difficult to execute. And I don't think anybody in here or anybody watching really thinks that only 22% of the CDC employees showed up for work at the building every day before the pandemic. They think it was probably 78%. And now the number's reversed. It's going to be hard for me to support more appropriations until we have a better relationship, a more trusting relationship, a more transparent relationship between the agency and Congress, which you're asking to fund your activities. With that, I yield.
Next.